All right, welcome to the August Fireside Chat. I guess Lindsay did tell us they're starting. I was just so intrigued with this storytelling, but we've got Lester Morales with us for the August 18th, 2026 edition. And like always, it's going to be awesome. So appreciate you guys being here. Um, Lester has been, what is this, number three that you've done with us, maybe?
Number
Something like
three,
that.
yeah.
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 And all three times, I'm forecasting here, top rated podcast of the year. It's going to be great. It's going to be fantastic. So,
Wow.
that we're, I know the last two were highly reviewed. So I appreciate everybody jumping on and being here. As always, you can go back and watch this recording. It'll be on our website under the educational section. And you can watch any of the past episodes. As we go forth and we get this thing started, you're going to see the ability to ask questions. I prefer you not do it through the chat, but do it through the Q&A. That'll help me keep organized and keep Lester on track with the questions that come in. Otherwise, Lindsay, let's go ahead and throw the slides up. And do we have slides, or are we just doing full?
Yeah, no, I've got slides. I think I'm in control, so watch
Oh,
out.
you're running them. Okay.
Yeah.
Even a bigger tree.
Lindsay, trust me, I think she said.
We'll see. We'll see if they get up. Something's happening. There we go.
All right, I think we're good.
All right. So we will be talking about renewal strategies, and it's not too late. I know we're mid-August now, and I'm sure many of you guys are thinking that summer went by pretty quickly, and some of us probably feels like we didn't get a summer because it stayed busy. I know for us, it's been a really busy, active year, and it sounds like that's been the case for most everybody out there. So I'm excited to hear what Lester has to say. Please ask questions as we go through, and with that, let's get this thing going, Lester.
Yeah. I agree, Heath, on the questions. As much as I talk, I don't want to hear my own voice the whole time. So, for those of you I've never met before, Lester Morales, I'm the CEO and founder of Dysrupt Healthcare. I always have to start off kind of bringing us all back to hopefully the why you get out of bed every day. My dad was diagnosed with multiple myeloma when I was 15. That's cancer of your bone marrow. And my parents had to eventually file bankruptcy because of medical expenses. So you always see those statistics, right? 67% of personal bankruptcies happen because of medical expenses. And most people have insurance. And it's kind of driven everything that I've done in healthcare. I spent 15 years at Willis Towers Watson, the first 9.5 as a producer. I grew my own $3.5 million book by the time I was 30. And then I was the chief growth officer for North America. So been around the block, both on the kind of advisory side and kind of on the whatever I call myself now. But we only build unbundled health, self-funded health plans. And so, when Heath and I were prepping for this, it's like, holy cow, we're sitting here. How is it almost September? And I don't know about you guys. Every renewal I have seen has been bad. Like I literally have not seen a good one yet. I was thinking through this, like, okay, you get a bad renewal right now, and then you see surveys like this. Employers are cost shifting strategies. I'm like, thanks, Mercer. Thank you very much. This is what normally happens. And so, guys, on the phone right now, the reality of this conversation of people are getting an increase. And what is the average advisor doing to actually help that? And again, most people, number one strategies are just going to raise cost, and it's bad everywhere. I mean, whether we're talking about specialty drugs, anything. And so, kind of the cliff notes I always think about is like the definition of insanity, right? And if you don't have a plan, so I'm going to leave you with a couple of things. And Heath, I promise we will have a fireside chat here in a second, not a Lester monologue, but I really encourage everybody to have a story when they have this conversation, about what's happening. Like, nobody wants to talk about health insurance. They need to understand the mechanics of the storytelling. And I'm just going to show you a real life example. So I did not put this in 6 Degrees branding because I want to show you real life stuff that we use in front of a client. And Heath, you'll love this, right? I always start with this, where I ask clients to think about both the cost and the quality of healthcare changes depending on where somebody goes. This is factual. That MRI over there cost X, that MRI cost Y. The last place person that walks across the street in med school is still called doctor. I said walked across the street, walked across the stage rather, is still called med school. So this is factual. We know for a fact that the cost and the quality of healthcare changes depending on where somebody goes. And most people have never thought through this conversation. So most consumers of healthcare have never shopped for price. So if we know this, now the conversation is super incumbent upon us to now get an employer to understand, what are the levers? Like, how can you actually impact this? And so these are real life slides. If anybody wants these slides, just send me an email and I will literally give you our entire presentation. I am somebody that, is all about the rising tide lifts all boats, but this is exactly how I talk to conversations. The first thing you have to do, and anything that any advisor comes in to Mr. Employer to talk to you, Mrs. Employer to talk to you, the first thing that they have to talk to you is, how are you going to buy a claim for less? And obviously, that's something you guys talk about every single day in regards to buying a claim for less. Now, when we think about that and we have optionality in our healthcare plan. So if you think about how most people have approached healthcare, most of us on this phone, even as brokers and advisors, we've insulated the consumer, the employer, the family. We've insulated the consumer from having to make any really tough decisions. Like, consumer-driven healthcare didn't really give anybody any decisions to make. It just put a couple $1,000s in the way of accessing healthcare. But I just showed you the slide that says, well, there are differences in price. There's differences in quality. So if we understand that we could buy a claim for less, then we have to help people make better decisions and become better healthcare consumers. And so I always talk to employers about, these are the levers. First of all, you got to be self-funded. What do you call somebody, Heath, this is always kind of my joke, play with me since you're the only one that could talk on this. What does Blue Cross, we'll pick on Blue Cross right now. What does Blue Cross call an employer's premium? And anybody in the Q&A or the chat want to put it in the answer? What does the insurance carrier call the premium that they get paid? Revenue. Pat Moore, you cheated, dude. You've heard that a million times. Nobody wakes up in the morning wanting to lower revenues. So we know that the cost and quality of healthcare changes depending on where somebody goes. We know that the people in a traditional setup of an insurance plan calls what we give them revenue. And we're sitting here shocked that healthcare costs continue to go up. So then it's like, okay, let's get you in a funding strategy that's going to work. And now let's pull on 4 levers. And I'm not going to go through all of them because I'm going to show you examples. But, Heath, when I have a conversation, and I'd love to wrap with you on this about with a employer, it's like, right now you're buying everything and it's a nice little bundle. But I asked them to kind of separate this bundle and then think through the different components of that bundle. And so the storytelling that I am telling you as advisors to start doing is really education through storytelling, because you can dismantle the puzzle and put it back together in a piece that doesn't really drive that much disruption. And so when I say it's not too late, Could you imagine showing somebody a couple $1 million of savings with an easy pull of a lever? And so I'd be curious, kind of on the flip side, when you're trying to make a brand new employer think through this conversation, do you guys kind of try to relate that story back to how they're buying claims today?
I think it's a matter of educating them to what they're actually doing. I mean, a lot of times I don't know that they know. And one of the other battles that is there is finding an advisor that is one. I think it really differentiates yourself, but many of them I don't think are want to put the work into doing it and putting the pieces together. It's like where's we'll talk to some of the big houses and they'll be like, well, who's the TPA pharmacy and network, and they're talking to us about who the network is, which is a pretty good indication. And it's just like they're just not giving a lot of thought to it, and it's just everybody just is like on the treadmill. Yeah, can just keep going. Let's just keep going. So it's always a pleasure to meet people like yourself and the people that you work with that they get it and they understand it. And they're willing to put a little extra work in, and there's a huge benefit to that. So.
I look at this and it's interesting when you think about the workload, right? Are these types of plans harder? Yeah. What I think our industry does so poor is we're scared to have a compensation conversation. So, and what I mean by that is, again, I wish everybody was live and like, how many people have a, accountant or an attorney? I don't know about you, Heath. My accountant or my attorney, they are not bashful in the least to send me an invoice for their services. And it doesn't, hey, every 15-minute increment call, I'm going to bill you. And I don't give a shit. Like they are stoked to send me that invoice. When I think about us, we're professional services. We actually touch by far the largest percentage of an employer's P&L possible. Between employee salaries and benefit cost, most employers are spending 60 to 70 cents on the dollar on those two things. So when I think about that workload conversation, guys, if a client is paying $5 million for healthcare and their broker's making $150,000, and you were able to help that employer pay $4 million in healthcare, do you think that they would be okay paying you $200,000? And the answer is yes. That client would be stoked to take $50,000 of their $1 million savings and hand it over to you if you just had a real conversation with them about this type of work is harder than the rest. For that, we expect to make more money. We will put our fees at risk because we know you're going to save money. And when we do, we'd like some of that dollars as extra compensation. I'd be curious, Keith, when you sit with employers and sit with brokers, do you hear a lot of people having those conversations about like, hey, when I kill it for you, I need to make more money?
Not typically.
And it's nuts. Pat Moore's on this call. He and I wrote a group with a property and casualty broker in DC, and just on the RX, it was about 2,500 life group. Just in the RX, we were saving these people $3.5 million. And so we said, hey, our fee is this, plus we want 10% of the savings. Quantifiable. This isn't like insurance math where it's like, oh, you got a 12% increase. I got it down to 8. I saved you 4%. No, I'm still paying 8% more. This is a real life savings. And so I wanted, if you were okay, Heath, I wanted to walk through real life examples of things that people could do to actually save people money right now that they could still leave this call with some real life examples.
Let's do it.
So I'm going to jack up the screen here again. And again, this is in very terrible, like Frankenstein branding, because I wanted everybody to see like these are like real life conversations. Like this isn't like a sales presentation presented to this. So, guys, if you're not starting with the conversation of pharmacy, please start. And I'm gonna always educate on, you know, literally how we have a conversation today. So my first thing with pharmacy, I will always ask, how and how much do you pay your pharmacy benefit manager? Guys, write down that question and please use it every time you have a employer conversation. How and how much do you pay your PBM? And I want you all to think about that right now. Think of your best client, and your best client, if they're bundled with Cigna, answer that question on behalf of your client. How does the PBM make money and how much are they making? Because the answer is you have no idea how much they're making. And a lot of advisors don't even know how much or how they're getting paid. So I wanted to show an example. This is a drug run. So think of every employee goes to CVS, Walgreens, Walmart, wherever, gets a drug. And I want you guys to key in on the top 3 drugs. They're simple statins, right? Run of the mill, everyday drugs. And I want you to key in on these 2 columns. Now, these 2 columns are showing you what the average cost during the current PBM, and when we did a repricing analysis, what the actual transparent cost is. So you'll see here that the reality of this is this statin average today 34.47, this one 73.27, and this one $20.16. The actual cost of that drug is 305, 347, and 195. So when we think about the how and how much, well, the how is I buy it for one and I sell it for the other. And if you've never shown an employer this, what's great about it is they can fact check this. If they can get their own data, so either way, if they've never seen it, it's a great education. They're like, well, yeah, if you get your data, I could actually rerun this for you. But let me tell you, you're not going to get the data. And this is probably what your PBM or your current broker is going to tell you about getting the data. And when they do, you should wonder why. I call it setting the banana peel. You educate them on what it is. You tell them the question to ask. They go ask that question. You've already told them what the answer is going to be. And so when all that happens, you just sit back and now you're automatically in a position of power. So the how and the how much is right there. Then we talk about the expensive drugs. So here's a great example. This is obviously a report from Cigna. This is their run of the mill, guys. And so I'm showing you this because your prospects right now just got this data set. And I want you to cue in on these drugs. These are 10 drugs that they spent a tremendous amount of money. So this client spent $3.4 million on just those 10 drugs. And when you look at this, nearly 5 of them have a manufacturer's assistance program, and nearly every drug has an international sourcing. So think about this. 10 drugs could save this client between $1 million and $2 million easy. Keith, I don't know about you, but in the scheme of things, you run a business, you're an owner in 6 Degrees. When you guys are looking at your own health insurance, like you have to make these tough decisions, but most advisors aren't bringing these types of even conversations or analysis to even the table.
Do you think it's because they're afraid of what they don't know, or they don't want to come across as they don't know what they're talking
pull
about?
the audience. We have an audience. It'd be interesting, guys, if they're at all, and put it in the Q&A. I think I heard the rules. I'll follow rules. What is it? Like, where is the apprehension? Because it's an interesting thing. I do think that there is some level of like, hey, I'm not going to get in a conversation that I don't understand all of the things in. But then I'm like, okay, well then bring somebody with you. Heath, I don't know. Will you go on a meeting to with a broker to pitch an employer? Will you be like their sidekick?
Always happy to join if there's a ability to get in front of the client for sure. Yeah, I don't know. I mean, you think through some of these scenarios, like I do think there's apprehension where people are afraid to come across like they don't necessarily know all things. But there's such a incentive in place to differentiate yourself from everybody else, you know. And so the opportunity is there. Just need people to take advantage of it.
The other thing I get a lot is, hey, I've been taking my client down this road. Introducing this is kind of counter to the way we've been taking them down the road. So they're a little embarrassed, right? Like, hey, I was telling them HSAs were the best thing since sliced bread, and now I'm telling them that HSAs suck. Or, again, pick an example. And to which, my automatic rebuttal, and Heath, I'll use you as a subject, so you have no idea what I'm going to say. So, Heath, do you work with a financial advisor?
Yes.
So if your financial advisor came to you tomorrow and says, hey, Heath, I am a part of this group. I went to this conference and I actually learned something that I think could take your portfolio and increase it by 10%. Are you mad at your financial advisor that he or she didn't know that new thing yesterday?
No.
Are you happy that they brought up that they could help you more than they're helping you today?
Yep.
And if they made money off of your extra 10%, if they made a portion of your gain and they made it, are you mad that they made more money?
No. I mean, it depends on what they're charging me,
Right,
but
right. 99%, but versus your 1%, right. But like I think about this and I try to sell the way I like to buy, right? And I really look at this and ask myself, if any advisors out there, and number one, they're not having these types of conversations, start. If you're not comfortable, there's people that'll go with you, whether it's the PBM, people like me, people like you, I mean, all over the place. And if you're worried about what your employer client's going to say, I can assure you, and I probably meet with 15 employer clients a week. I can assure you I've never had a broker bring us in, or Heath, you've never had a broker bring you in where the employer's like, I hate you for bringing me this innovative strategy. It's never happened. So I'm going to show you a reference-based pricing conversation. So again, I said my first lever that I like to have a conversation on is buy claims for less. And so this was an actual group that Heath, I have run with you guys, and it's a interesting scenario. So I guess I'd love to leave people with their talk track. So this was the savings analysis that y'all did. So first of all, I send you data. You send me back something that helps me show a client that I can save them 4 million bucks. Okay, so pause. Let's now think about this. Client gets renewal. Renewal is going up. Status quo normal broker shows them ways that they could cut their benefits and get that renewal down incrementally. That same broker sends you guys this data. You guys put an analysis to save 4 million bucks. Now, I ask myself this all the time. Let's pretend I know that this client's not right for RBP for whatever reason. What's the downside of showing them something that I turned over every stone, everything, and now get to have a education conversation about the worthlessness of a network discount. Like, do I look at that weird because I'm all Pollyanna and I love these stuff, or do you kind of feel that same thing? Like, what's the downside of showing a client something?
Oh, I agree. I mean, I guess if we really want to dive in, the only downside would be us doing the work on our side, but that's what we're here to do, right? We know the we know the statistics that we have to hit, the number of these that we do to get clients on board. But I think it opens up a conversation. At least is showing the advisor is turning over every stone. And if you don't go full reference based pricing, maybe you do a dual option. Maybe you do a slice component to this, or an out of network strategy that incorporates RVP, or you at least start with pharmacy or large claim or something like it gets the conversation going.
And I think what's interesting in this conversation is, let's pretend brokers prospecting. Um, One, if you've never seen most, and I don't know who's on the call, so I don't necessarily want to poo-poo on any brokerage shop, but there are a lot of brokerage shops that either have a very negative spiel or feeling as an advisory firm around reference-based pricing. I have seen advisory firms make their clients sign kind of a held harmless, that like, hey, you're going into RVP. And so what I love about that conversation is, from a phishing standpoint, like, hey, you're trying to prospect. I love the confrontation. And Keith, I'd be really curious. It says, hey, you hand over this analysis to an employer client whose advisor has told them reference-based pricing is noisy, it's loud, it's all of that stuff. And in fact, they've told us never to even consider it. What's, put yourself in the broker's shoes. What are you rebuttaling right there?
Yeah. Yeah. Oh, what if I was the broker?
Yeah, if you were the broker.
I'd
And
ask, what's their incentives for not exploring this? Like they're that's probably the biggest is what the network's paying them to keep them on a network plan. But
what I love to ask in that conversation is just asking the client to ask the broker how many clients they have that are doing it.
yeah.
Right? Because like in that situation, like, you're not accusatory. Oh, that's interesting. How many other clients does this broker have that are doing this strategy? Because in my actuality, and I could show you, and then like, Heath, in your proposal, it's gonna show the success rate in the high 90% of time that a provider, professional or facility, are going to take the reimbursement amount. So like, what I love about that is, let the broker look foolish by poo-pooing on something that 1-0 of their own clients are doing. And in the same presentation I'd like to review with you, Mr. and Mrs. Client, it's been our experience that 97%, 96% of hospitals love this strategy. So I'm confused why you're getting that information.
Well, the other diving a little deeper into this thing is the amount of variables that are at play to, even if that advisor made that statement, who was the TPA, who was the RVP vendor, where was it located, and what was the personality of the plan that was running it. All these things play into the success of these, strategies, especially the RVP vendor. There's such variability between the different options that are out there. Some are proven to be quite successful and ask what their retention rates look like, or others that maybe at some point in time were successful, but changes have happened and, they're really struggling to service accounts right now. So those are all things that play into this.
This slide is probably just with the opportunity to have how worthless discounts are is one of my favorite slides to have a conversation. Again, leaving you with questions and things that you can do. I love getting a carrier report and showing that they said somewhere they have a 55, a 62%, whatever it is, discount. I would venture to bet 95% of employers and probably 90% of advisors, when they use the terminology discount, they forget the rest of the sentence. Discount off of billed charges, right? And it's an interest, and I'm guilty. I literally would charge clients hundreds of thousands of dollars to do a network discount analysis when I was at Willis. So like, I am so guilty of this, but I never really understood what the hell I was talking about. So Heath, maybe you can give your version of when you talk about the discount, how do you frame it so a very novice employer client would understand?
Like furniture sales, maybe. You know, you
Okay.
can you can get a huge discount, but as long as you're setting the starting price, it doesn't matter what the discount is because they're getting the number that they want. So if they know they have to give a 50% discount to make the market happy, well, instead of selling it at $100, you're selling it at $200, and they still get their $100, right? So it's just a mouse game. When RBP is at play, you're actually using verified benchmarks and coming up from it. So it kind of level sets that, the hide and seek of the billing practices. And the other thing that we did was create MetaV, which we've had from the early days of 6 Degrees, but it really takes all those data points and puts it into a usable fashion to which you can really sit down with an employer and see billing practices, discounts, what their cost ratios are, and what a Medicare multiple would look like in that situation. So it's very, very eye opening in terms of what you can do with that analysis and the data. And
I'll
I'll give
tell
you.
you.
I'm going to do one
But
story before you go because
yeah.
I'm getting a few slides behind on where I was going to do it. But talking about advisors that don't go and speak to their clientele. There was a big brokerage house that had a plan of ours prior to us taking it over, and they never did approach the employer about an RVP strategy. And same thing, we were told that they'd kind of poo-pooed it and just said it's not something you want to do. But they had an employee on the plan that happened to be the spouse of an advisor that we worked with, and they had a big claim themselves. And so we were able to take that claim because they had the claim data and run an RVP model on it. And they did take that to the employer. That was probably 6 years ago now. And that employer fired the big house, went with the smaller advisor, and they're 6 years into huge success on RVP in a market that people would probably say was tough. But when you have everybody in alignment from an administrator to the RVP to the advisor and the employer, we have the ability to customize what that plan could look like, which incorporates a lot of contracting. There's a few network plays in there as well, but they're saving, on average, I think $6 to $7 million a year, year after year without any increases, going on 6 years now. So that's what RVP can accomplish. And that's what RVP can accomplish for advisors that are willing to go have this conversation with the employers out there.
So, I put some bullet points here so that some, folks on the phone can take away some some talk track. And, again, I don't work for 6 Degrees, so I partner with them. They help me win business. I think I have a Meta V slide in every single thing I do ever and have for the last 5 or 6 years. And so when you think about this, I always like to have the question with the client. Hey, who decides how much an MRI is? And it's funny how like dumbfounded people's faces are when you just ask that question, right? It's like, well, the insurance company and the hospital. Which one of those two entities have a vested interest to lower healthcare costs? Pause and let them stew on these. Like clients have never thought through a lot of these talk tracks because they pay premium to somebody and they don't see what happens on the other end. And and so I should have probably switched question or statement 2 and 3, but I'm like, hey, when's the last time you saw I had a healthcare service? Or I will tell them my knee surgery story, right? So like, if you don't have your go-to story, have one. If you don't have one because you've never had any healthcare, then make one up. But like, have a story that you talk about. But what I love about it is everybody's always, I call it the Tylenol story. Hey, when's the last time you accessed healthcare? Oh, I had this, I had this. Yeah, okay. So you saw your EOB? Like, yeah, I was like, that really fake price, when they bill you $9 for a Tylenol, that's the build charge. And they're like, oh, and everybody has a story. Like once you start engaging this conversation, everybody's had an EOB. They've looked at it. They've wondered what the hell it says. They've just never done anything about it because their plan doesn't give them any options to do anything about it. And what's great about it is, okay, so you saw that and then you saw the allowed charge, right? You see the difference. My story, my knee surgery cost $90,000. When I worked for Willis, we had Aetna, and Aetna took their 50% discount. So it was a $45,000 surgery, of which I had to then pay my $5,000 out of pocket. So the insurance picked up 40, I paid 5. And a client kind of starts to get this conversation. So in that discount scenario, they got a 50% discount. And then you pull up your MetaV slide that shows Florida on average, is something like 800 or 900% of Medicare, and says, okay, well, you got a 50 or 60% discount on something that was overinflated by 7, 8, 900%. And I will always ask, have you heard of Medicare? It's crazy, obviously, duh, but so Medicare, let's put this easy. Medicare pays that hospital $1. That dollar is being billed at $8 to the commercial insurance companies, and you're getting a 50% discount off of that 8. Do you think that the hospital loses money on the dollar? Let's pretend that they do. Let's pretend that the dollar is break even. We're still in RBP going to pay them a 30 to 50% margin on top of that. I don't know about you. I'd love to run my business where I'm making a 50% margin. Like, I would love it. And so, guys, this conversation, it lends itself so great to the teachings, but less about the teaching and more about, well, yes, about the teaching. I said, and the positive. It allows you to throw out so many banana peels on what the client is doing today and who they're doing it with. So I cannot give you any more like urging of educate, ask a question, encourage them to go ask their vendor, their whatever, their broker that question. Give them what you think the answer is going to be. Set that banana peel. Any words of wisdom on that? And then I'm going to show one more thing, and then we can get out of here.
No, I think those are all good. I kept envisioning the Mario Kart with the little banana peels like dropping
Yeah,
behind
yeah,
me.
yeah. Yeah, I used to like Yoshi. Yoshi was my guy. Like I wanted to drive with Yoshi. Yeah. Any questions coming in at all before I hit the GLP strategy? Because then that's my last thing.
It's been a little quiet on the Q&A. Come on, guys, step up. You got Lester won't be shy in the answers, so ask the questions.
Well, I will show one last thing, and this I have shown this 5 times in the last week because of the Bank of America article that came out. I don't know if everybody saw it, but like Bank of America says they spent $250 million on GLP-1s. And you have so many folks that are, eliminating from the plan. Cigna, right, themselves for their own employees eliminated GLP-1 for weight loss on their own plan. So interesting things happening with GLP-1s, but everybody has a problem with it. So I'm going to show you a real life report and then walk you through it here. But we had a brand new client. They are in California. They wanted to keep GLP-1s for weight loss and obviously for diabetes. And they said, but we don't want it to be a crutch, right? We want it to be because and part of a lifestyle change. So we helped them design and got a PBM and a wellness vendor and the TPA. So, and I'll drop names because I think it's important that the right partners are there. So, I come on 6 Degrees, thinks that they're a good vendor. So Personify was the TPA and the wellness vendor. They've got a really good program called Transform. And Drexy was the PBM, or is the PBM. This is all live, like going on right now. So starting January 1st, so we take over the account. We move them from Optum to Drexy. It's 10,000 employees. The first quarter, everybody's grandfathered. And then after that, everything that is more than $1,000 a month requires a pre-auth, and we're going to run the playbook. We're going to try to get them on a 340B, an international sourcing, a manufacturer's assistance program. The plan design that the employer changed from went from that tier of medication at a $70 copay to a 20% max of $250. So somebody could theoretically, if they didn't play along, go from 75 to 250. Now, here's the best part, and this is when you get HR, finance, CEO, everybody in the room. It was, hey, we are going to charge that delta in cost only if that member has an opportunity to engage with one of these other programs. So they actually said, Heath, hey, if there's not a medication that can be sourced through 340B, through international, we don't want to penalize that employee. We want them to get it at the old copay, which was the $70. So I'm going to show you a couple of things. One, and this is blurry, but I got screenshots of it clear. We track this week by week. This is literally every row is a week. This is weight loss. Oh, no, this is GLP-1s for diabetic, GLP-1 for weight loss, and this is specialty only. So I want to show everybody. We've been tracking this since the end of the grandfather period. So GLP-1s for diabetics on the 16th of April, 51% of them were getting their medication through the 340B or the international sourcing. Last week, or the week, I guess this is now 2 weeks ago, or two reports ago, it was 97%. So Heath, in English, what that is saying is 97% of the people who have a GLP-1 for diabetes is going through a program where we are saving the employer 60% on that diabetes, on that GLP-1. For weight loss, it started at 65 and now it's at 95. So when you think about that, guys, a strategy that is requiring somebody to engage is not telling them that they can't get it. It's telling them that you want them to be part of the solution. They've got to engage. And so this wellness program, it's called Transform. you got to go on the portal and log some things, and you got to do weekly stuff. And what they said is if you miss 9 weeks aggregately or 3 weeks in consecutive, you're no longer eligible to get GLP-1s for weight loss. So if you think about this, we're going to save this employer about 60% on their expensive drugs. So think about Bank of America in that example. You could have literally saved them over $125 million with this type of solution. So I tell you this, guys, because there's not a employer out there that is not struggling with GLPs. Two, the best strategy that most advisors are doing is let's try to get the highest amount of rebates. And three, if you're using and tracking on a weekly basis, this gives you more and more data. I have used that report on more prospect meetings in the last 3 months of any other report. So, Heath, again, my goal, although we didn't talk all about 6 degrees, was what are some ways people could literally have conversations with employers right now to actually win business? Because it's not too late. Everyone's going, even if they don't go with the solution now, how many times can an employer stare at a couple $1 million savings in a row without eventually going with it, right? So I think about this like, they see the 6 degrees analysis this year, they don't go with it. Hey, that's okay. I get it. I'll see you when you get another 18% rate increase next year. At some point, the client's going to be like, what the hell am I doing? Am I an idiot? So I just like this repetitive education, showing them examples of other people and asking them to engage, which I have just found to be the number one way of getting employers to do this stuff.
I like the banana peel concept. What I'm thinking through some of the things that we're seeing come in. I mean, it really has been. It feels like a sense of urgency that we're seeing from advisors right now, and I think it goes back to the renewals that people are getting. What is like the average renewal that you're seeing come in right now?
So this has been interesting. I think it's very geographical, but I'll tell you some anecdotal stories. One, I think everybody saw the PwC report that says this is going to be the worst renewal year in 17
Yeah,
years.
we've seen
Uh,
several of those reports come by now.
yeah. So again, I like using that. Call it a scare tactic. I don't care, but you call it something. Um, in California, we had went to an event, and the Blue Shields representative said that their best performing block of business on an insured basis is going to see a 15% rate increase. Their best performing block. I think of the things that I have seen, I'm going to say high teens has been, kind of the median there.
The how about the you always the tactic is to delay, delay, delay. When the renewals come out from especially in the smaller plans. But if you're the advisor, there's no reason you can't get proactive in terms of taking a look at these strategies so that you're ready, right? And maybe you don't want to have to change anything, but you also know it's coming. What are your thoughts on that?
I love producing and I'm trying to find one on the fly here. I love producing a impact assessment off of either assumptions or data that I can get off of benefits flow or my edge or something. So Heath, hey, I want to prospect that group over there. I know they're 500 lives. I can go on to my edge or benefits flow or just guess. Hey, I think they're paying 15,000 PEPY and just make assumptions, right? This much is in medical and RX. This is and put together an impact assessment and send it as a prospecting tool to that employer, saying, hey, I don't have your data, but I just used averages. And I think at the end of the day, this is what you might be experiencing. And I'm going to actually literally pull one up. I just got one. So I just did this with a group the other day, and this is the crawl, walk, run. Well, the run is RVP. So I always think, hey, do nothing, crawl, walk, and run. And then I talk about the different levers of this, but I use this in every sales presentation possible, because at the end of the day, there is no way they can not look at this and take this seriously. And so sometimes I'll run 10, 15 of these with the broker who's prospecting all of it, and they'll write a note, hand deliver it, or send an email saying, hey, I got your data off of this. Here's what I'm looking at. I ran that through our modeling tool. I could save you $2 million over the next couple of years. I'd love to talk. Worst case scenario, give me your real data and I'll run the analysis. So let the client come back and be like, you're full of shit, but at least I tried. And like, again, how many times can you look at something? Most people are showing them how to pass on an extra deductible to save a couple points. You're showing them how to transform the way they buy health insurance. I mean, that's a completely different conversation.
Yeah, and for the advisors on the call, we can run one if we got data, it makes it a lot easier. But we can also run some hypotheticals for you. But everything from a financial analysis to disruption report, for the folks in the stop loss space in the call, we can get you those same reports as well. It might help you sharpen a pencil. So there's a question that came in. Lester, if you can see it, it might be easier just to read.
Yeah, I got it. I got it up right now about the 50 Life group.
Yep.
Yeah. So I obviously know this is a gradient term. So good here. Typically what you'll see out of the gradient report too, they'll give you the names of some medications or whatnot. Literally, I just did an analysis for a group in California yesterday. I should be able to get it. We didn't have, here it is. I want to make sure I don't say the client's name because that would not be nice. But I'm going to let me take this name off here and shrink this. Okay, I'm going to literally share this. This is as impromptu as you can get. Share here. So this is literally the impact assessment that I did for this client. And more importantly, I think it's the slide before. Oh, here we go. This was the gradient output. They had a 1.25, approximately 6.8 million in claims. And somewhere, I think it's in the RX section, they gave us the name of some of the actual medications. Now, it's probably, here we go. Here's the gradient report. So most of them are in oncology, autoimmune, Stelara, Skyrizi, Humira. And so I took this and literally, I don't have the data. I just had the gradient report. And I showed the client, I'm like, look, these drugs are in these other reports. I don't have your drugs, but look, Skyrizi, Stelara, Enbrel, Ozempic. I mean, literally, you're getting savings of 76% on Enbrel, but you got to do something different. So, for the broker that asked that question, what would I do? I would take that report, show the client that specific medication or the fact of what you would do with a large claim. So let's just take it, Heath, on an RBP scenario. Hey, you had a large claim. You had 7 of them that were $100,000. That's the paid amount. If the paid amount is 100 and you're getting a 50% discount, that means it was billed at 200%. right? And now you start doing the RBP conversion. So like somebody can do the RBP conversion, to your point, on a specific claim or a specific group of claims. It says, hey, if you paid the same 7 groups not using the BUCA, but an RBP, that 7 would have cost you X. Now it cost you Y. It's just arithmetic in the middle.
Yeah, and when you really start getting into the financial component of this, it's not just savings to a plan. It becomes savings and benefits to the members of these plans, and what you can do from a benefit design or salaries or you name it. You can get really creative when you start reducing your medical spend by 30%. So
Heath, I'm going to leave everybody with what you just said here. I often have conversations with advisors, right, on like, hey, you might not be, as schooled in these conversations, but I view us all kind of in the Spider-Man, right? With great power comes great responsibility, and knowledge is the number one power that we can have. So like now that these things are available, now it's incumbent upon us as an industry to go spread this word. And, I say that with what you just said, Heath. I am a product of parents having to file bankruptcy because of medical expenses. My dad's drug, Revlimid, has a patient assistance program and can be sourced internationally. So my parents would have never filed bankruptcy if they were on a plan that we helped design. So I think of this isn't bullshit. This isn't anecdotal. This isn't Heath and Lester rapping about different things. This is legit conversations about how you could save employers on their second largest expense, but more so, this is how you save people real money. And this is real when we think about it like that. So, I don't know if you have any. Julie Selesnik is next, man. She's way cooler than me. So nice work.
Yeah, Julie's great. Julie's great. Join us in September. I know we didn't get to all the questions. Elizabeth, you had one that came in there at the end about the TPA. I think it really depends on what you're looking for, the part of the country you're in, and all the different pieces that play into that. But happy to have a conversation with anyone that has specific questions around those things. But definitely want to make sure if it's for RBP that they're doing a lot of RBP. RBP is not for the lighthearted, especially on the admin side. We do a lot of the lift, but TPA plays an important part too. Lester, thank you so much. It looks like I've got a back-to-back call here, which Lindsay, don't do that to me. I got to sign off on these things. Thank you guys. Enjoy your rest of your August. Fantastic job, Lester. And
thank you.
We're out.
See ya.
Bye, guys.